Welcome. I'm Doug Morgan, and you're listening to Uncommon Sense, where we hunt for the truth in the topics you're not supposed to talk about, Christianity and politics. All we hear from leftist leaders is that the government needs more money. I mean, have you ever heard of a government official saying, "Oh yeah, we have too much money," or "Hey, what you sent us to do and gave us money for, well, we've accomplished that, and we need to shut everything down." No, but if you look at how our tax rate has been growing and what taxpayers are getting for that money, this is definitely not the case that they need more money, right? Government actually needs less money, and it would work better, in my opinion. It is interesting to me that as loud as these Democratic leaders shout about needing more money, they never want to be good stewards of the money that they are given. Luke Rosiak of the Daily Wire just dropped a huge bombshell of an investigation into a massive amount of fraud that has been happening in plain sight. He said, and this comes out of Ohio, the state of Ohio. He says, just before the Department of Government Efficiency closed its doors, it made a quiet move that may end up as its most lasting impact on the federal deficit. DOGE published a massive trove of data in February that, for the first time, lets the public see what companies are billing Medicaid for. For decades, the payouts have been shrouded in secrecy. One of the largest government programs was a black box. I've spent the past 2 months diving into the numbers, and what I found was the most blatant waste of federal dollars that I have encountered in my 2 decades as an investigative reporter. This is the first part of Medicaid Millions, which is what he put out a 3-part series, and we're going to cover this series and see what he has uncovered in this investigation. But what he uncovered was personal services, payments that where people are paid to spend time with their own family. He said, I set my sights on Ohio, which is like Minnesota, has been granted waivers to expand Medicaid well beyond its original purpose. Under the guise of health care, Ohio pays people to go to Medicaid beneficiaries' homes to perform homemaking and chores, like cooking and cleaning. The people performing these personal services, as they call it, these tasks, they don't even have to be healthcare workers, and in many cases are actually relatives of the Medicaid recipient. Now, according to a Daily Wire data analysis, Ohio spent $1 billion with a B dollars on home health care in 2024. That's the last year for which data was available. Since the services are performed inside private residences, there is no way to know whether the workers went at all or what they're actually doing in exchange for taxpayer funds. An infinite number of small black boxes inside a big black box. Multiple signs said the service provided and billed to the government was sometimes just companionship and conversation. As people have realized, the United States government will pay them to hang out with their own family members. Northeast Columbus has seen its economy replaced by businesses that bill Medicaid. And Columbus, a city with the second largest Somali population in the country, has become, on the surface, the most unhealthy city on the planet. Quote, well, if the government is going to pay you to do it, one home health operator told me, people see it as lucrative, so they just jump on it, unquote. The new welfare queens aren't the recipients whose low incomes qualify them for, poverty programs. They're the companies getting rich off them. Driving down Cleveland Avenue in less than 40 seconds, you come across endless home health companies. Capital Home Health, Continental Home Health, Dynamic Home Healthcare, Ohio Senior Home Healthcare. Entire buildings throughout the city are filled entirely with what appears to be identical businesses. The enormous complex picture, they have a picture of it where it's located at 6161 Bush Boulevard. Its lack of windows would be a problem for most office buildings, but there is almost no one in this building. What's inside is 94, I'm going to repeat that, 94 different companies signed up to bill Medicaid, each with a tiny office, often marked with a sheet of paper proclaiming some generic company name ending in Home Health LLC or something. And sometimes another piece of paper claiming the employees had just stepped away for a break. This building alone billed taxpayers $66 million in the span of just a few years, is what the records show. Pick the owner of a Columbia home healthcare company at random and look him up in public records, and you are likely to go down an endless rabbit hole. Years of unpaid taxes and debts, sometimes criminal records, and an astonishing number of LLCs created in other industries, such as the millions they made from Medicaid are just a side gig or something. We went down several of those rabbit holes. He says in the coming days, you'll meet a politician who founded an $11 million home health care company that he appeared to run part-time without even mentioning it in his political biography, who funded his campaign with donations from other healthcare owners. You'll meet a woman who reinvented her janitorial LLC as a health provider and then billed Medicaid nearly $100,000 the first month. You'll meet a landlord who bought airplanes after renting space to hundreds of home health care companies that billed Medicaid $250 million. How about a $1 million Medicaid business owned by a couple with a repeated fraud, violence, and theft convictions? How about a man who went to prison for Medicaid fraud, but told the government he was too broke to pay restitution, while his neighbors and associates preside over a poverty program empire? And how about an accountant who lost his license for stealing public funds and then opened a $7 million home health care company using the address of a convicted money launderer's teenage son? These are not business geniuses, nor even people with any training or specialty in the health field. They have often failed at a variety of businesses before suddenly becoming millionaires in a home health care business. Sometimes a company will have a full roster of clients in its very first month, making one wonder where are the clients coming from. The companies don't have websites or appear to advertise. They can't stand out from their thousands of rivals based on price unless they pay kickbacks, because the government pays the same to everyone. Nearly every owner of home health care companies in Columbus appears to be foreign. They live in a parallel society where every associate in public records also has a foreign name, and all their business transactions are conducted with other foreigners. When we asked one what home healthcare companies did. One man threatened, journalists? Who cares? Do you guys pay my bills? I'm not going to tell anyone you guys, I'm going to tell everyone that you guys are racist. The government cannot be meaningfully monitoring all the people it writes $1 million checks to in Columbus, thank you. They all share combinations of just a few names like Muhammad Ahmed and Ahmed Mohammed. Documents reviewed by the Daily Wire show individuals will spell their own name multiple different ways with a single document. And many of them list their birthdays as, yeah, you guessed it, January 1st, because their birthdays are unknown. The business model is simple. A 40-year-old Somali immigrant gets paid for spending time with and maybe cooking for his own 65-year-old mother. The middleman is one of thousands of home health firms that have the NPI number necessary to bill Medicaid. The 40-year-old becomes an employee of that company, but has no clients other than his mother. There is no way to verify whether he actually even provided the services, unless his own mother is willing to testify against him, of course. This poverty program is different from things like food stamps because it has no monetary cap, and its extent is decided not by politicians, but by any doctor willing to sign a form saying you could use some help around the house. It only takes one doctor who will say yes to churn out enough forms to bankrupt a state. For years, efforts to rein in waste have nibbled around the edges, shaving off $1 million here and $1 million there, while skeptics and liberals argued that the cost-cutting exercise was pointless because the lion's share of the federal spending was locked up in non-discretionary spending like healthcare. Remember that? The implication was that there was no waste in that category and nothing could be done about it, even as the nation careened toward insolvency. That premise couldn't be more wrong. This blatant waste happened within miles of the Ohio State Capitol, where Governor Mike DeWine, a Republican, by the way, and his appointees run the state. In an age of artificial intelligence, the Medicaid system has seemed disinterested in even the most obvious red flags. Perhaps that's because it's largely run by states, but with half or more of the bill being footed by federal taxpayers. The Trump administration is now turning its sights to Medicaid fraud with a task force led by Federal Trade Commission Chairman Andrew Ferguson and Vice President J.D. Vance, of course. They may want to start with Vance's home state, of course, in this case. You see, the front doors are open, but inside, the 7 massive complexes appear to be largely abandoned. Smoke detectors chirp for new batteries. No one is there to change them. Some office doors have signs suggesting the owner is out to lunch, but the piles of mail outside tell a different story. Stray cats have taken up residence in the parking lots. The government is under the impression that all of the office buildings hold thriving healthcare businesses. The 7 buildings along East Dublin Granville Road in Columbus, Ohio, are filled with hundreds of office suites, all owned by a company named Cordoba real estate. A large majority of the tenants in the buildings bill Medicaid, the taxpayer-funded medical program for the, of course, impoverished, as a home health care business that provides low-skilled, usually non-medical care to elderly or disabled people. Now, as we said, the Daily Wire has spent weeks analyzing Medicaid data released by the Trump administration's Department of Government Efficiency, or DOGE, in an effort to weed out wasteful government spending. The buildings owned by Cordoba stuck out, each housing dozens of businesses that build Medicaid. So, in all, the Cordoba-owned buildings in Columbus house 288 businesses registered to Medicaid. I'm going to repeat that again. In all, the Cordoba-owned buildings in Columbus, just that one city, they housed 288 businesses registered to Medicaid. This is what the investigation found. Together, they charged taxpayers more than $250 million between 2018 and 2024. That's in a city where only 6,273 people, 75 or older, are on Medicaid. That's crazy. The Medicaid program has exploded in Ohio thanks to a waiver that expanded the medical program to include wide-ranging at-home services such as homemaking and allowing taxpayer money to be spent on tasks such as making the bed or working on a hairdo. Ohio has 3,700 companies with home health in their name. According to a review of Ohio business records, in particular, it's blown up in Columbus, which is home to the second largest Somali population in the United States. The program has little oversight, with most of the so-called care happening inside individual homes, making it susceptible to fraud and abuse, of course. Now, there's no evidence to indicate that Cordoba has any role in the Medicaid companies housed in its buildings. It sold 2 of the 7 buildings this January, in fact. Yet the home health business, their businesses have been established as if by a machine, with some sharing nearly identical signs that suggest, coordination rather than rivalry. One sign for National Home Health Care Services, LLC, explained that the home Medicaid businesses often don't provide health care at all. They provide services like companionship and conversation and light housekeeping. Next to it hung a sign proclaiming, "We are on break right now." Another sign for Guidance Home Healthcare LLC was graphically identical. I mean, even with the same slogan, "Your peace of mind in home healthcare." Only the phone number was different. At one Cordoba building, he says, I finally located a rare home health business with someone in it. He finally did it. GC Home Healthcare LLC asked how he recruited employees. Abid, that's the owner's son, said employees and patients come as a package. In 70% of the cases, the employees are being paid to spend time with their own family members, is what he explained. Now, usually, and this is what he said, quote, this is the quote, usually the patient, they have someone in their family that has the qualifications to be an aide, CPR and everything. So they just come to us, unquote. after getting a note from a doctor vouching for the elder's need for personal services. They come to us. The family member of an elderly person isn't set up to bill Medicaid, so a company stands in the middle. And this is what he says. It says, we're taking a small cut because Medicaid pays us and we pay them their hours. This is what Abid explained. He said the number of hours depends on the doctor's recommendation, but it is often an hour a day. You expect them to take time off work to take care of their relatives. There has to be some sort of benefit. Asked why people wouldn't simply help their aging parents without billing Medicaid, and he said, well, if the government will pay you to do it, it's an incentive. I think most people nowadays, they don't really care as much. Each animated graphic shows a Cordoba property along with the owners or managers of every company located inside that is billing Medicaid, as well as the names of any other businesses in the building that received money from the state of Ohio. Medicaid is a joint federal-state program. So some of the state total may be, included in the Medicaid figure. The data comes from federal Medicaid and Ohio spending records. And getting rich off taxpayer money while failing to pay taxes, that's a thing. Inside this Cordova property at 5900 Roach Drive, many of the businesses have signs saying the employees are on break, but there are indications that this might be a ruse. It's clear that no one has been entering JLL Home Healthcare LLC, where the door doesn't even have a doorknob. Yeah. It's adorned with a "Sorry, we're closed" sign and featured the bizarre slogan, "Steaming to assist." Steaming to assist. It was incorporated by Coffee and Adoma. Coffee Adoma is his name, who also owns a trucking business called JLL Transportation and Logistics, is what the records show. Down the hall at First Choice Health Home Healthcare LLC, when we visited, there was an envelope sitting by the door, postmarked 5 months prior, from the Ohio Attorney General's Bureau of Criminal Investigation. Vetting such a business would be almost impossible. In Medicaid records, its CEO is a person named Ahmed. Yeah, Ahmed, with no middle name, just Ahmed. Another company, Medina Home Healthcare, led by Nirmala Adhikari, received $410,000 from the state of Ohio, and they received $22 million from Medicaid. So that's, $22 million from Medicaid, $410,000 from the state. Its billing topped out at nearly $1 million in 1 month in December of 2023. Its website is a dead link. Yeah, and it hasn't posted to its Facebook page since September of 2024. Its last post says the author was transitioning to helping people write essays to get into college in the United States. His LinkedIn says he lives in India, but majored in feminism and social justice at the University of California, Santa Cruz. With so many companies, all virtually indistinguishable from one another, lacking websites or advertising, and changing the same charging the same Medicaid rates, the question arises: how do they recruit patients? Billing patterns show rapid and unusual growth. Well, ZNC Healthcare, owned by Isaac Amaroko, $11 million, by the way, had 93 claims in September of 2018. Then suddenly, 1,065 the next month. Yeah. According to the data, those are the numbers. 93 claims, and then suddenly a month later, 1,065. An audit found that 65% of ZNC's Medicaid payments didn't match up with its staff electronic records. And auditor did not recommend any repayments after ZNC said its employees are confused. Moonlight Home Health Care, run by Sassy Kaza, there's a name for you, took $9 million. Moonlight's office was not just closed when the Daily Wire visited, but there was nothing inside. It billed around $20,000 a month until skyrocketing to more than $500,000, $500,000 a month in December of 2023. Like a shocking number of home health care firms, it appears to have failed to pay its own taxes, taking millions of taxpayer money but refusing to return to Uncle Sam even his share of corporate profits. Tax records reviewed show Moonlight has 7 state tax liens against it, totaling $70,000 from 2022 through December of 2025. That's despite the fact that Kaza was, in fact, moonlighting. Yeah. The irony is just thick here, isn't it? Yeah, he was moonlighting. He was simultaneously running Comprehensive Behavioral Health Associates in Youngstown, Ohio, which billed $32 million for community psychiatric supportive treatment, as they put it. The latter company has its own $600,000 federal tax lien against it. And a website that contains only stock art and doesn't contain the name of a single doctor or employee or their qualifications. With those companies seemingly in trouble, Kaza has leaned into the industry. In January of 2025, he established Lifeline Home Support, registered to the same exact Roche Drive address as Moonlight. Somali politicians find the true American dream in Medicaid millions as well. In fact, at 2700 East Durban, there are 80 companies that collectively billed at least $73 million to Medicaid and receives $23 million from the state of Ohio. 11 billed more than $1 million. 2 claim Suite A alone. Continental Home Healthcare, Inc., led by Dekwa Mohammed, which, according to government records, billed $15 million, and Dynamic Home Healthcare, owned by Syed Ahmad, who the government paid $10 million to. Bernard Conadu's Buckeye Health Agency charged $15 million, according to the records. An audit found that it billed the government for visiting people at home when that was highly unlikely because the same people were simultaneously in the hospital. Down the hall is Omega Home Healthcare Services, which charged taxpayers $11 million between December of 2017 and October of 2024, the time period for which data is publicly available, of course. A picture of a flyer posted by the company says it provides services like hair care and homemaking, which entails cleaning and bed making. Yeah, Omega was incorporated in 2011 by Mohammed Jama. Really. He's a Democratic politician. Jama founded a newspaper called the Somali Post and a Somali coffee house, and has been affiliated with the Somali Education Resource Center, which also received, yes, you got it, $6 million in federal dollars in 2023. all on top of raising 9 children and working as an engineer. And when he ran for state senate as the Democrat nominee in 2024, the multi-million-dollar home healthcare business didn't even get a mention in his biography. Quote, Jama came to the United States as a refugee, seeking a better life. Now, just 25 years later, he is part of the true American dream, where freedom, opportunity, and hard work can give any American a chance to achieve. This is what his campaign website said. Jama lost to a Republican, and in April, he boasted on social media that he met with Mohammed Salad, the head of Somalia's intelligence agency. He previously ran in the Democratic primaries for the Ohio State House of Representatives in 2020 and 2022, and his campaigns were boosted by the home healthcare industry, with at least 44 donations coming from home healthcare companies or their owners. Unlike most political campaigns, he ended up spending less than he raised. Yeah, ending the latest campaign with $31,000 left in his campaign account. Jama started the Medicaid business on the side when he was in college, and he said anyone can have a business and can have another job so long as he has a good team, he said. He said that he sold the business years ago. Incorporated paperwork suggests the sale was October of 2019, and Omega was making up to $90,000 each month before the sale, according to federal Medicaid data. And in April of 2025, Omega underwent a routine audit of a sample of its records by Franklin County's independent auditor, which found some impossible claims. In some cases, on the same day that Omega said it went to people's houses to take care of them, hospitals also billed Medicaid because they were inpatients there. Omega declined to submit an official response, is what the auditor said. So instead of concrete, repercussions, the auditor simply recommended that Omega refund $1,000 to cover the cases where Medicaid's own data proved the impossibility of home visits. Yeah, that's it. Just give us $1,000. As for the millions of dollars in other claims, the program would simply take Omega's word for it. On Facebook, Jama said he works as an engineer at Whirlpool and that he was fired from a previous job where he was underpaid because of his skin color, but that he did not complain about the financial impact because what they do not know is that you build a side business with close to 100 people on your team, he said. Yeah, there's a lot more here. So let's do this. I'm going to pause here and we will finish this up on Wednesday. Obviously this is a big deal and we need to dig deep into it, because this is yours and my money. This is taxpayer money that's just going right down a hole, and it's fraudulent and it's being exposed, and we need to stay on it. So let's do that. I'd love to hear what you have to think on it. Of course, you can always do that at uncommonsensepodcast.com. Thank you for listening. This podcast is a production of Morganite Communications.